to public health nutrition. I hope my slides are moving. Are they?
Yes, they are.
So yesterday we had looked at malnutrition, and we saw what it really means, and we also looked at the interventions that we can put in place to deal with it. So the interventions are right there, and we had discussed as far as food assistance programs, micronutrient supplementation, and then nutrition education. So this therapeutic feeding program was not captured in the recording, but it's basically the feeding that is given to those children, especially who are suffering from severe acute malnutrition that could even lead to hospitalization or death. So they are given these foods which are ready to use or ready to eat. They do not require to be cooked again, and they help rebuild their nutrition and prevent them from the adverse complications of severe acute malnutrition. And uh, they can be provided as milk-based formulas or fortified blended foods, or what we call ready-to-use therapeutic foods, or the ready-to-use supplementary foods. So these therapeutic foods feeding programs may not be standalone, but sometimes they can be integrated with immunization. Like I was saying yesterday, we do not have to wait for children to get that severe acute malnutrition or for them to come to the hospital. But if we are doing immunization maybe at community level and we discover that there are some children having severe acute malnutrition, we can always integrate therapeutic feeding programs within those interventions like immunization, malaria prevention, and HIV testing and counseling. So you're doing one intervention, but you bring in this other therapeutic feeding program. Then the other intervention to deal with malnutrition is to tackle it using the community itself, which we are calling community-based approach to malnutrition. And in this case, involve the community, involve them from their leaders to the volunteers in the community to the groups that are existing in the community, like the farmers groups, like the community health workers. Involve them so that they can be able to identify the problem that is existing, that could be leading to this malnutrition. You could be thinking that maybe there is malnutrition because people lack food, and yet it could be something else. Okay, they could be having food, but it is not in diversity. They may be feeding on only carbohydrates. So you discover that there is malnutrition, but you do not know the reason. So the beauty with involving the community is that you're able to identify the problem, but also the community can give you feasible action plans. What are we going to do which is applicable in our setting? Okay, then they can also the community-based approach also helps in monitoring and evaluation, because you're able to track using the community itself, but also you'll discover that when your program or an intervention is owned by the community, then it will be sustainable. Okay, because they will feel part of it. When you give these therapeutic foods, if you give food assistance to the community, and and the community really likes what you're giving them because you involved them in identifying the right foods that they need, then they will be able to own that program. Okay, instead of you choosing what to give to them without consulting them. So that is the beauty of this community-based approach. And the other thing, you're able to get information about food production, consumption, how people generate income, which they use to get food, healthcare access to treat those malnutrition cases, and the social norms which could be limiting access to some of the foods in certain populations, like we mentioned yesterday, that you could find that women are malnourished because they are lacking proteins which they could have got from meat, and maybe they are denied meat because they are women. So you get to understand these social norms from such community-based approaches. Then in policy and advocacy, we said that for you to implement any program as a public health official, you need to focus on nutrition. And focus on create an environment that can favor that program or prevention measure. So you do that by involving these policymakers, the people who draft the laws, the policies, the implementers. And here we are looking at the national governments, the parliamentarians, the donors, private sector, regional bodies. They come, they will be helpful in this advocacy. Okay, they are able to identify the key policies that will be good for the thriving of those nutrition programs and ending malnutrition or preventing it. So in this case, they are always guided, of course, by these global and regional initiatives that are already in place, like scaling up nutrition movement, World Health Assembly nutrition targets, and then the UN Decade of Action on Nutrition. And when you're in Africa, of course, they look at this African Union agenda, which shows you how we can always achieve health and productivity. So you cannot achieve better health and productivity without focusing on eliminating malnutrition, because when people are not feeding well, they're not going to be productive. Then malnutrition is also related to the SDGs. You cannot alienate or take away the connection between malnutrition or nutrition itself with poverty, hunger, health, education, gender equality, water and sanitation, and then climate change. And all these components are in the Sustainable Development Goals. Okay, so if you are going to tackle nutrition, you have to see a way of dealing with poverty, as we saw in the other UNICEF malnutrition concept framework. They show the causes of malnutrition, and in this case, if you're going to eliminate this malnutrition, you need to focus on all those uh, root causes. And in this case, we are looking at poverty, that poor health, lack of education or poor education, gender inequality, water and sanitation, which could be poor, and then the climate change. Remember, when there is climate change, for example, if there is a drought, then you will not have production. Okay, if there are floods, even the crops will be damaged. So if the crops are damaged, then people are not able to access food. Okay, so you realize that malnutrition is a problem that requires multi-sectoral and multi-stakeholder approach for us to deal with it. We should have people from agriculture, we should have people from health, we should have people from the economics, because they have to tell us about how poverty can be dealt with. We should have people from the water and sanitation, who are the public health people, and then even all of them come together so that we deal with this monster in the room. So at the end of the day, we realize that malnutrition is a topical subject that needs us to work together. All of us in different sectors who are concerned with malnutrition need to come together so that we can deal with it. And if you involve all those stakeholders, you're able to benefit from their expertise, but also their resources, and you'll be able to deal with malnutrition. The UN, which set these SDGs, requires us to eliminate hunger. And of course, if you eliminate hunger, then malnutrition will also be eliminated indirectly. So requires us to eliminate hunger by 2030. Are we going to be there by that time? Are we going to be having a malnutrition free society or communities by 2030? That is a question to ponder. So that was for yesterday. Today we are going to focus more on the nutritional needs across different ages. Okay. Yesterday was malnutrition, but so I wanted us to just finish up off those slides, and then we can look at what is the package for today. And I hope you're still with me. Are we? Are we still together?
Yes, we are.
Okay. So today we want to look at this interesting topic of nutrition needs across uh, all the ages that a person can pass through. So we realize that when we are growing, we have different nutritional needs. So we also acknowledge and appreciate that whether it is a pregnant woman, whether it is a lactating woman, or that woman who is breastfeeding, whether it is an infant or a child who is below 1 year, or children who are between 1 year and 5 years, adolescents and adults, and even those of old age, we all require to feed. We all require essential nutrients, okay? But of course, these essential nutrients vary. So, one of the key uh, things that we have to learn from this session is that they vary, and as we grow, of course, we always require nutrients, okay, for growth and development. And as you are going to realize that when you're still young, you require a lot of nutrients, but as you grow older, the nutrient demand or what you require might reduce, okay? Because, of course, now in old age, you have reduced activity. People are majorly not, they are either not working or working less, those old people. But when they are growing and uh, and they are still, or when they are still young, they need a lot of nutrients for development, but also for that physical activity that they are always engaged in. Okay, yeah. So young age is always related with that increased nutrient need. But as you grow older, the nutrient need also reduces. So the various factors that can affect the individual nutrient needs include occupation, whereby adolescents or the children require more nutrients than the older adults. In occupation, those who are working less or the sedentary require less nutrients than those who are engaged in manual labor. And this is because when you're engaged in manual labor, you require your body will be metabolizing or burning the food very fast, so you will require more than this person who is not engaged in that manual labor, or those people who are just sitting in the office. Then gender, men and women require different nutritional needs, as we are going to see. Physiological factors, pregnancy, and or illness can also alter the nutrients that we need, as we are going to see. Then also climate. So people in cold, you have also ever experienced this. If there is coldness, you might feel hungry faster than when it is not cold or when it is hot. And this is all about the metabolism. So when there is increased metabolism or burning of food, it is always done as a mechanism of the body to produce heat. so that you can survive in those cold conditions. But of course, when it is now hot, the metabolism will reduce. Okay, so in coldness, you will feel hungry faster than when it is in hot weather. So there also can be a difference in the nutrient needs. So specifically, when we look at pregnancy, we realize that it is a period of increased nutrient demand and not restrictions. So someone should not be pregnant and then you think that because I'm seeing them having a belly, then they are maybe satisfied, okay? But that is a time there should be increased nutrient demand, okay? Remember, on top of themselves needing this food, there is also another individual or sometimes individuals who will require this food inside them, okay? So we realize that pregnancy or maternal nutrient intake correlates with birth weight. So there is a higher possibility of a person who is not eating well giving birth to a baby who is of low birth weight. And indeed, we realize that in the second and third trimesters, so we they can this pregnancy can be divided into three, like which we are calling trimesters. So that could be that those first 3 months, the second 3 months, and then the third 3 months. So the second and third trimesters always require more calories than the first one. So the first one, even if the pregnant woman is feeding as if they didn't have pregnancy, it's fine. But as the pregnancy progresses, they require more. And in this case, we are talking about 300 calories more, an additional 300 calories. Okay? And this will vary depending on whether the person is physically active or not. So when there is more physical activity, there will be more burning of food and they will require more calories than the person who is not burning these calories or engaging in physical activity. Additional protein is required for fetal growth, meaning that we need to to make sure that this pregnant woman is having enough protein, okay? Because we need the fetus or the unborn baby to grow well, the uterine enlargement to protect the baby and also accommodate the baby is also able to take place with additional protein. Then the carbohydrates also are very important in this case, so that you prevent the situation whereby the body of this pregnant woman has to resort to using stored fats. And when it uses stored fats to generate energy, that condition will be called ketosis, and you do not want that ketosis to happen. You want the 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 body to generate its energy by utilizing these carbohydrates. So you make sure that this woman gets carbohydrates with so the foods that are rich in carbohydrates, for example, uh, rice, matoke, many of them that are readily available. Then vitamins, we have B6 uh, that should not that might not be required to increase, but those B vitamins like B12, B2 can increase up to 80%, and then folic acid is also supposed to rise. And as we discussed earlier in our first sessions, folic acid is very important, especially for red blood cell formation. For you to have a woman having enough blood even during pregnancy, they need to take this folic acid. And then also this folic acid, we saw that it is very important in the growth and development of the spinal cord or the neural tube of the unborn baby. We also need calcium in this case so that there is no osteoporosis or weakening of bones of both the mother and the baby. Also need iodine to prevent occurrence of this condition called creatinism. And this creatinism happens when someone lacks iodine, which is used in the synthesis of a hormone called thyroid hormone. So this thyroid, when this hormone is not produced in sufficient levels because of lack of iodine, then the baby or the infant could end up with creatinism, which is not a good condition to have in your infant. Then iron is very important in synthesis of hemoglobin, which is an essential part of blood because it's where oxygen is attached. And then zinc is important in pregnancy to prevent infections. And these infections, of course, if not prevented, they could lead to miscarriages and birth complications. And zinc can be found in those foods, meat, fish, nuts, and legumes like beans or peas. Then during after pregnancy, after the woman has delivered well, and they are lactating or breastfeeding, we need to continue supporting them with the necessary nutrients like we are going to see, because remember they need that they need this for their bodies, but also to make sure that they produce sufficient breast milk to support the child that they are raising. Okay, and remember, these children, it is a policy, or it is always very recommended that if a mother is not having any serious complication, they should be able to breastfeed their child for the first 6 months. So for you to make sure that this mother does that well, then they need to be feeding well. Okay, and in this case, you expect the energy requirements also to rise. You expect a portion of this energy to come from the fat that could still be there even after pregnancy. We need calcium because calcium will be passed through it will be delivered through this breast milk to the child for better bone growth. Then during breastfeeding, folic acid needs to decrease because breast milk is rich in vitamin A, so it can compensate for that. So vitamin A recommendations are higher. It is recommended that when you're out there and you're communicating with these mothers, you encourage them to eat foods which are rich in vitamin A. Vitamin C and zinc are important to prevent infections again. Okay. Then B12 is also very important. Vitamin D, especially in people who are in high latitude. So in high latitude areas, there is always a problem of reduced vitamin D from UV light or the sun. The sun is a good, the sun, especially that of around morning time, is always good for to provide that UV light for vitamin D. But in high latitude areas, you find that it might not be available. So you have to give this supplementation either through eating food that is fortified with vitamin D, like milk that is fortified, or through other foods. Okay, and we know that vitamin D is very essential in also bone development. Then ions are also supposed to be reduced in this case, uh, and they are the ions are required in low amounts because there is no menstrual flow during this stage. So menstruation would necessitate you to supply more ions because we know that through menstruation there is always loss of those ions through the blood that is lost. So because of lactation, that hormone which is produced during breastfeeding, or to make sure that breastfeeding or breast milk is produced, that hormone which is called prolactin, it cuts off uh, ovulation and even all the other processes that lead to menstruation. So menstruation is not commonly found in lactating mothers. So because it's not there, then the ions might also not be needed a lot. Then in infancy, we are talking about a baby who is under 1 year. They are rapidly growing and developing, so they need unique nutrient uh, supply. And in this case, they require 98 to 110 kilocalories per kilogram of body weight daily, depending on age. So when we talk about these calories, will give you a simple picture of how to figure them out. When you talk about calories, for example, the proteins. Proteins, when we look at a protein, for example, like an egg, when you're calculating for its kilocalories, you look at 1 gram of that protein equaling to 4 kilocalories. So 1 gram of protein is equivalent to 4 kilocalories. Then carbohydrates is also the same. 1 gram is equal to 4 kilocalories. But when it comes to fats, 1 gram of fat is equal to 9 kilocalories. So you can see that fats have more calories than the carbohydrates and proteins. So when we are looking at these kilocalories, you should be having that picture in your mind, and that can maybe give you it can maybe give you a guide on how to calculate what you need to eat. Okay, but we shall look at maybe those calculations in detail later. So we are still looking at infants who are the children under 1 year. They require more energy than even adults, like I was saying, because they are developing on a fast rate. Their body is having also a lot of metabolism, or what they call basal metabolic rate is high, so they require more nutrients. But good for them, they can get most of these nutrients from breast milk. Okay, and human milk or infant formula, sometimes if the human milk is not sufficient or is not available, there are these infant formulas which are ideal for those first few months. And then as they grow, after those first few months, 6 months, like we said earlier, solid foods can be introduced, but of course they have to be soft. Okay, remember they require high energy needs, so they should be able to feed very well. So the rapid growth and that high metabolic rate is the one which causes this high energy requirement in infants. Okay, so in infants we need proteins, which can vary from 0.7 to 1 gram per pound of body weight, depending on the age. Then the intake we should always focus on those essential amino acids. And these essential amino acids are those that cannot be synthesized by the body but have to be got from outside through the diet. Okay, so they are available in foods like meat or beef, chicken. Uh, can also be available in eggs, milk. But we also know that when you're introducing this milk, you need to be very careful because, for example, in cow's milk, it contains high proteins which might strain or stress these infants' kidneys due to excess nitrogen and minerals. So you do not want to introduce cow's milk at an early stage. If it is very possible, you need to always breastfeed this child uh, instead of giving them this cow's milk. Then, in terms of fat, infants and children up to 2 years should obtain 40% of their energy from fats, because remember they require a lot of nutrients, and maybe you might not be able to get it. But as we said, fats have those they supply more calories than the other foods. Okay, so that is why they might need more of fats than the other food groups. So fats contribute to energy supply and support the nervous system development. They also help in addressing the challenge of infants' high energy needs, like I was saying, and that small stomach capacity. So the good thing with fats is that because even when they are a lot, they do not occupy a lot of capacity. Okay, and then in infancy we also need vitamin D and vitamin B12, and these can be got from formulas, or these that we looked at yesterday, the ready to use feeding formulas, or sometimes the commercial available formulas for infants, which are already having this vitamin D, which has been correctly calculated, and they are sure that this is what is very important in the growth of this infant. Then mineral needs, iron is also uh, important and can also be availed in these formulas. So these formulas are always like in powder form, and then they have instruction of how they can be mixed with clean water, so that you can give to this infant very well. Then infants who are breastfed should start receiving iron-rich foods after those first 6 months, and then adequate iron, zinc, and iodine are very essential in development and growth. Like we said, iron is essential for for synthesis of hemoglobin, which is a very important component of blood, and then zinc to prevent infections, and iodine to prevent the other condition, creatinism, but also goiter, since these are now children who are growing. Then in childhood, after that infancy stage from 1 year to 5 years, we also need extra protein, because again, the growth rate here is also a lot. So as we come from down, the nutrient requirements might reduce, but they also do not reduce drastically. Remember, these are children who are growing, and even their metabolism rate is high. The rate at which they are burning the food that they are, or the food is being digested, is higher than with the adults. Okay, so they require extra protein, vitamins, and minerals due to the growth and activity that is taking place. These are children who are exercising a lot. You see them playing a lot, so every time they play they are losing energy, and once they lose they become hungry, so they need food, because they need that food to grow and develop, but also for the proper functioning of their brain. Then protein requirements also slightly increase with age, and in this case, from 1 year to 5 years, we expect that if you do not supply iodine, then there could be a concern of anemia. So strategies to prevent iron deficiency should be emphasized during this period, and we look at dietary choices which are having iron in them. Things like red meat, or this normal meat that we know, beef, uh, will be having iron. Liver, can also be having iron. Then we have those. We also have iron in some of those vegetables like spinach. So they are very good sources of iron, which should be emphasized in this period of childhood growth from 1 year to 5 years. They should be able to receive these vitamins and iron. Then in adolescence, now comes a period also of significant growth and development. Because apart from this normal growth of increase in height and weight, in adolescence now there are those sexual characteristics that come in, okay? And they also require uh, supply or good supply of nutrients, because when you don't, then these puberty characteristics or the the puberty stage will be delayed. So you need to be supplying these adolescents with constant and enough food or nutrients. So in this case, we need to make sure that we need to make sure that when we are talking about adolescents, we need to make sure that the active boys eat, for example, more calories than the girls who are sedentary, or even the boys who are sedentary. In that case, there could be boys who are who are engaged in manual labor. So those ones will require more food than those who are not. And even the people who are sedentary or not active will require less of the calories than those who are participating in active in either active jobs or active sports. So the energy needs in adolescents are basically due to that increased metabolic rate, but also the growth and development still taking place in these people. Like I said, as we grow, we need these nutrients to help us grow, especially proteins, because those are the bodybuilding foods, but also this normal energy for our normal functioning from carbohydrates cannot be neglected. Okay, so we need to supply daily protein that can vary depending on the weight, because we realize that when there is inadequate protein intake, then that puberty, like I was saying, will be delayed, and there could be also reduced body mass accumulation. You've seen adolescents who do not look like adolescents, okay? Are still like young children. So that could be because they are not taking adequate protein, okay? Carbohydrates are also very important in this case because they are a source of that dietary energy. Before we resort to fats or we go to proteins, the body always first looks at the carbohydrates that are supplied. Okay, so fruits, whole grains, vegetables, and legumes provide those essential carbohydrates, but also they give us dietary fiber. And dietary fiber is very essential when we talk about normal bowel movement. Okay, so in when we look at dietary fiber, which can be found in many foods like fruits and vegetables, but also some whole grains like millet, but also like we can get it from avocado, bananas. We acknowledge that this dietary fiber is very essential in normal bowel movement, in that when you're taking such foods like avocado, bananas, there is there is a low chance of you getting uh, problems like constipation. And with constipation, of course, you can, if it takes a long time, you could end up with colon cancer, and we do not want such things. So For you to prevent that, you need to eat dietary fiber through such foods like avocado, yellow bananas, whole grains like millet, so that they can help you to prevent such chronic diseases. And the recommended dietary fiber intake for adolescents in this case is that you give them 0.5 grams per kilogram of body weight. So if someone is having 60 kilograms, then the grams that you're going to give them will be 0.5 times 60, which will be around 30 grams of body weight. So if they can get that per day, then they are good to go as far as preventing these chronic conditions like colon cancer or diabetes or constipation in the short run. Then these adolescents also require fat and cholesterol, but it should be in moderation, or it shouldn't be given in large quantities, because we realize that when cholesterol is given in large quantities, it can lead to those chronic diseases which result from this cholesterol accumulating or clogging in the blood vessels. So you have to give it, but in moderation. It is important in the development of these adolescents, but most especially when we look at the development of the nervous system, but it has to be given in moderation. It shouldn't be more than 300 milligrams per day, but also we need to make sure that we supply those fats which are not trans fat. Okay, and in trans fat, we are looking at those fats which have been solidified. For example, margarine is an example of that trans fat. So if it is possible in adolescents, we need to make sure that they avoid such foods. Then calcium is important for their physical growth and bone development, and it prevents the risk of fractures. Okay. And when we look at old age, remember in old age, like we had said at the beginning of this session, the systems are aging, but also the physical activity. This could be someone who has maybe retired from their job, they are no longer working, they are no longer moving a lot. So their energy levels have reduced, but that doesn't mean that they shouldn't be given food. Okay. So in this case, the energy needs decrease by approximately 5% per decade. The more you age, the more they decrease. Okay, the more years you spend on Earth, the more the energy levels decrease. What you require for your survival decreases. Okay, but that doesn't mean they should be neglected. And it decreases, like I said, due to that reduced physical activity, but also the metabolic rate. The systems being senile or aging, the metabolic rate is no longer as much as the young people. Okay, so maintaining activity, of course, is important, so that one, you can be able to have good bowel movement, and the food that you eat can be metabolized very well, but also it is important to prevent you from the chronic diseases that we looked at in those first sessions. Okay, so protein in this case of old age remains very vital, because you do not want to experience muscle wasting, or to be an old person who is looking malnourished, who is not having any muscle on them because they are aging. No, that's why they need also to be having this protein. But also it helps in supporting their immunity system. They need these proteins so that they do not suffer from those uh, unnecessary or small infections here and there. So they do that, they can achieve that through supply of protein. Okay, then carbohydrates are very essential. Of course, even in old age, because they are the main supply, they are the main source of energy, fibers, so that fiber rich carbohydrates like those whole grains, e.g., millet, is essential in promoting digestive health. Like I said, if you supply fiber or dietary fiber, then things like constipation are not going to be present in such people. Okay. Fats need to be also taken in moderation because we saw their their adverse effect. You do not want to be aging and you add on something like heart attack or a heart disease or stroke because of eating a lot of fat. So they need to be taken in moderation because they have a way of supporting the nervous system, like we said, for uh, those nerve impulses to be fired very well, or for you to keep on functioning with a good uh, nervous system, you need some fats, okay? But they need to be taken in moderation or in a regulated way, especially in old age. So that's it for today. And from since we looked at old age as the last, that means that we've almost covered those age groups or life stages which are very essential in our development. So from this presentation, we have majorly focused on those life stages which are very critical and could be vulnerable to face uh, the evils of not eating well. So we discover that there could be uh, different requirements of nutrients at different life stages. What you give depends on the physical activity of this person, but also their metabolic rate. And this, of course, uh, increases or it reduces as you go up the radar. As you increase the age, the basal metabolic rate will go down, and then if it goes down, that means that even the nutrient need or the requirement of someone in terms of feeding will go down. Okay, so that was it for today. Unless there is any question, I'd like to end here. Is there any question from us?